MALDI-TOF, Vitek and serotyping you can perform. You can also go for antigen detection, we have discussed. And nowadays there is some resistance seen to fluoroquinolones. So not in all cases macrolides and ciprofloxacin works. So you have to perform antimicrobial sensitivity test and give the patient treatment accordingly. What is this case? 2 years old child presented in OPD with abdominal pain is there. With the passage of loose stool, mother noticed blood and stool. Blood and stool is dysentery. On examination, temperature is high grade with mild dehydration. So there is this dysentery. What are the etiological agents? And one important protozoa. Okay. There are some etiological agents such as you said E. coli, okay, Shigella, Campylobacter jejuni. What is this? What kind of mortality is seen in Campylobacter? Almost similar as Vibrio. Okay. EHEC, EIEC. What is that? Enterohemorrhagic and enteroinvasive E. coli. These two Escherichia coli are implicated in dysentery. Then Vibrio parahemolyticus. There are some parasites such as Entamoeba histolytica, Balantidium coli, Trichuris trichuria. What is this? Schistosoma mansoni and Schistosoma japonicum. Do they where do they have their habitat? In the venous plexus of the blood flow of small and large intestine. Where does the Schistosoma hematobium reside? Urinary bladder. Okay. What kind of specimen will you take? Fecal specimen, you will again perform macroscopic, you will see that it adheres to the container, it has blood and mucus. And preparation of the wet mount will show you that there is no pus cell. Okay. What about culture? Culture media remains the same in both the cases, except you will see in case of Shigella, these colonies that had, in case of Salmonella, they had black centers. In Shigella, they do not have black centers here. Okay. In case of, in McConkey agar, there will be non-lactose fermenting colonies. And Shigella will show you non-motile, non-capsulated, short, non-gram-negative bacilli. What happens in case of Shigella we discussed? No gas, no H2S, alkaline by acidic, growth in TSI. Okay. The difference between amoebic dysentery and bacillary dysentery should be that in case of amoebic dysentery, you will see that this consistency of the stool, it is adhering to the container. You can ask the similar question to the patient also, right? And in case of bacillary dysentery, it adheres to the container. Okay. Number of motions should be more in case of bacillary dysentery. In case of amoebic, it should be lesser, but the amount will be copious. But here in bacillary dysentery, it will come out in small quantities. So the patient is complaining you of painful defecation in small quantities in case of bacillary dysentery. Okay. What about this? "72 years old female, extreme of age, admitted in ICU, broad spectrum antibiotics for more than 7 days. Large score, you can tell about, let's say, more than 10 days, about 14 days of administration of broad spectrum antibiotics she had, and she developed sudden onset of frequent watery diarrhea, passing the stools at 10 to 12 times per day. What do you think this is? Which organism? Clostridium difficile. So, what kind of disease is this? This is toxin mediated disease again. Why did it happen? Because the Clostridium difficile, which is a commensal flora in the gut, it took over the other organisms which are the protective bacteria in the gut, died because of the usage of broad spectrum antibiotics, right? And they developed this disease. What happened here? Pseudo-membranous formation. What are the antibiotics that can be culprit here? They could be cephalosporins, clindamycins, fluoroquinolones, right? What do? They break the epithelial barrier of the intestine through these toxins. What are these toxins? Toxin A and toxin B. Toxin B is a cytotoxin. It tells you that this is destroying the cells. It is breaking the epithelial cells. They are secreted in the intestine by this Clostridium and GTP binding proteins that regulate the cellular actin cytoskeleton, which is protective barrier of intestinal mucosa. They will disrupt this and it will lead to diarrhea because of the inflammation that is caused by microorganisms. And they will form this pseudo membranes from all the inflammatory material, and then the person will develop this disease, may go into the shock after dehydration and hypotension. What kind of culture media is available for this? Since it's an anaerobic organism, you will see cefoxitin, cycloserine, fructose agar. What does this mean? You are providing fructose for the growth. These two antibiotics are inhibiting other microflora that is there in the gut, so that it enhances the growth of C. diff. Okay. Also, you can perform antigen detection through ELISA or presence of GDH. What is GDH? Glutamate dehydrogenase. This enzyme can also be tested. You can also perform PCR targeting these genes. What are the drug of choice recommendations? Which vancomycin? Oral vancomycin, okay, or metronidazole. Then seven-year-old girl for regular school health checkup. On examination, she had pallor. What do you mean by pallor? You say anemia, okay. Then underweight for age, it means malnutrition. Gives history of occasional passage of worms in stool. So there is parasitic infestation. What is the diagnosis? Which parasites cause anemia? And hookworm is the right answer in this case. We have made it like that, but you can also say what you answered previously. But just remember, whenever anemia comes into the action, you have to, unless otherwise, if typical egg history is given, like if they tell you that we observe this kind of egg, the egg specifications are given. Until then, you can write all the examples you just said. Okay. Then what was the diagnosis here? Iron deficiency anemia. She had pallor, she was underweight and malnourished. Probable cause could be hookworm, Ankylostoma duodenal or Nicator americanus. What will you perform here? The mainstay of treatment will remain to treat the causative parasite and replenish the iron sources in the body. So what will you do? Stool microscopy will show you segmented eggs of hookworm. You remember how does the hookworm egg look? It's oval with segments in. Okay. There are some other methods also that you perform, such as you can take stool culture, Harada-Mori filter pepper method. All these techniques can be performed, you don't have to go into much detailing about it. What else you can do? You can do molecular methods, but in conventional way, what do? You take the stool sample and inspect it for the eggs in the stool sample. Okay. What is deworming strategy by the Government of India? It means you take one albendazole tablet, 400 milligrams, every 6 months, especially for the children who play in the soil. The children of school going age, they are given this prophylactic measure, especially in the high risk areas where these cases are found most commonly. Okay. What is this? "38-year-old male presents to the outpatient department with complaints of burning epigastric pain." Very good. For past 3 months, pain is worse on empty stomach and partially relieved after meals or antacids. By which organism is implicated? Helicobacter pylori. Okay. 2 kinds of tests you perform in case of H. pylori, invasive and non-invasive. So whenever you talk about non-invasive tests, you talk about urea breath test. What is it detecting? CO2 gas, right, which is produced by, because of reaction with urea, which is produced, urease, which is produced by H. pylori. Then you can go for fecal antigen assay and antibody detection by ELISA. These are non-invasive tests. In case of invasive test, you can perform endoscopy guided biopsy. You can stain this with Wharton starry silver staining and gram staining. What will you be able to see? Gram negative bacilli, curved gram negative bacilli. Just you have to remember culture media that are used for H. pylori, Skirrose media. Okay, they are given microaerophilic condition, which means 5% oxygen they are provided, and you keep this for incubation in 37 degrees. Also, urease test is positive and you can go for accurate diagnosis by MALDI-TOF. What is MALDI-TOF? Automated identification system. What do you require for MALDI-TOF? You have to grow this in the culture media first, and then you can provide it to MALDI-TOF machine, and then through the database you can understand which organism is this. Okay. What is the treatment regimen here? It has to be a quadruple or triple therapy in which you are providing antacid for your stomach to produce less acid and let the cells treat themselves. Okay, if you keep on, the stomach produces acid, you know that, for digestion, right? For that you are giving antacid. You are giving antibiotics to kill the microorganism, to kill the microflora. This microorganism, H. pylori. And what else you are giving? You are giving bismuth subsalicyclate. What does that do? It protects the ulcers. It protects the mucosal layer of the stomach and prevents the further ulcer formations in the stomach. Okay. So this is about H. pylori.